had gone right up to over 1,000 per 100,000, and you'll see that on the graph that we had a bit of a peak there, and that was in the sort of the last few weeks of the summer term, and then they've come down quite quickly since then, but have sort of stabilised. So, you know, we did see a big drop, thankfully, but the rates are sort of sticking at what they are now. We've also seen our, you know, data around other areas such as, you know, our deaths. We had seen that go up, that's stabilised now. So we were running at sort of just under 2 a day. We haven't had, you know, that has come down now. So we are in a position where, you know, the numbers are very small, obviously not like what we had earlier on, as you can see in that graph where we had a period of time with no deaths, but we haven't seen a sharp rise in that. So in terms of where we're at, and I suppose where we're expecting to go, you know, we have seen a slight drop off in some of our testing numbers. We would anticipate that will increase slightly because when the schools go back, which I'll be coming on to, there will be a lot more testing of secondary school pupils. But we are still seeing, you know, quite a high number of tests to be getting those cases, and we're averaging around about 100 cases a day that we're actually seeing. So it certainly has not gone away, you know, and that is why it's important that, you know, we all continue to be as vigilant as we can, and it's really important that, you know, and appreciate that you are supporting us to get these messages out into the community. So that's where we're at in terms of the current situation. We would anticipate that the case rates will start to go up. We've seen that slightly, as I've mentioned. We are seeing other parts of the region go up. At the moment, the North East region, I think, is the sort of second lowest region in England. You know, we were at the highest in the sort of end of the summer term, but, you know, it is going up everywhere, and people have possibly seen the impact that's happened in Scotland, where schools and workplaces are back after their summer break. So, you know, we are anticipating something to sort of follow that pattern, really. So although it has come down, as I've described, we are looking at a quite a high background rate if we're hovering between sort of 260 and 280 cases per 100,000. So that's it on the data. In terms of what I wanted to pick up in terms of COVID update, in terms of policy and guidance, the main thing is around the self-isolation guidance. So what is important to remember, because there's been lots of changes and I suppose lots of information out there that close contacts do not need to isolate if they meet certain criteria. That doesn't apply to everybody, but the really important thing that everybody needs to remember is if somebody is symptomatic of COVID, they should still be isolating and they should access a PCR test, and anybody who's tested positive must still isolate. So if anybody who's positive, it's still 10 full days of isolation that you must do. All of the definition of what is actually a close contact has not changed. So a household contact is still a close contact. A face-to-face contact, so, you know, a conversation being coughed on, etc., is still a close contact. Close contact with during the infectious period within a metre of somebody for 1 minute or more is still a close contact. Being within 2 metres of somebody for more than 15 minutes, either at one period of time or over the course of a day, is still a close contact, and being in a vehicle with somebody would still be classed as a close contact. And it would only be if somebody met all of these, any of these criteria here, so either fully vaccinated, which means actually you've had the full dosage for the vaccination you're getting, and it's been 14 days since you've had that. So, you know, if you've had your full dosage, but your close contact has been with a positive case 2 days after your last vaccine on that schedule, you would still have to isolate because it hasn't been 14 days. And that's because we know that's how long it takes to get the full impact of the final vaccination. Anybody under 18 years, 6 months, and then if you've taken part in or are currently part of a vaccine trial, which means, you know, you may have had a slightly different vaccine sort of schedule. So that would apply. And then anybody that has a medical reason, but you do need to have to prove, you have some proof that you do have a medical reason for not being vaccinated. And it is still the case that if you are a close contact, if you don't have to isolate, so if you meet any of those criteria, whilst it isn't mandated, you would still be encouraged to take a PCR test, but always to remember that if you've had a previous positive PCR test in the last 90 days, do not take another PCR test, because there's a high probability it would come back positive and you'd have to isolate again, even though you might not be infectious. However, anybody that gets a new onset of symptoms in those 90 days is still required, because they'd be classed as symptomatic, to take a test, as I've described just earlier. And to think about, limiting that close contact with people, wear face covering. So if you were with people you're not normally with, so outside of your house, in a crowded area, inside a building, generally, so going to the shop, it is still a good idea to wear a face covering and to take part in the twice weekly testing. Now, what we do have is, and we hope it's going to work, there's a short video that's been produced, and this is there for you to be able to use and to bring to the attention of other people if anybody's got any questions about self-isolation, because I can absolutely see that it will be confusing for some people. So I'm going to click on this. It's just about a minute and a half, I think. See if we can get it to work. It's doing something.
Can always rely on the technology, can't we?
I'm keeping my fingers crossed.
I can't see it.
Oh, 1 second then. So what I'm going to do, I'm going to come back out and I'm going to stop sharing that presentation, and I will open that, and then I'm going to share again. So let's see if we can get that link through. Bear with me one moment. Right, can you see that now? Oh, actually, 1 second, because I should have said to turn that on. Right, we should have it now, I think. Can people see that now?
Yeah.
And we should have sound. Okay, so that was the sort of update on the current picture in terms of the rates of infection and the key change, which is around the self-isolation. So before I move on to the schools, I will just pause there to see if there's any questions. No? Okay. I will move on to schools then, if that's okay.
We'll include the link to that animation in the update next week. I think we included it last week and we'll pop it in next week as well, this week.
Okay, so people should see something back on their screens now that says back to school key messages. Can people see that? Yeah, brilliant. Okay, thank you. So the key messages are testing is still a really important measure alongside all the other infection control measures that should still be continuing in schools. So, you know, when we go back, so staff should have still been asked to test sort of regularly. So a lot of them will have been tested and will test before they go back. So they test at home in terms of staff, and that's in early years settings, it's in primary schools, secondary schools, and then further education and higher education. They all have access to that regular testing with lateral flow. When secondary schools go back, they have been asked to re-establish their asymptomatic testing sites and to provide access to 2 tests on site. They'll be 3 to 5 days apart. And then from that point onwards, all of the staff and the secondary school pupils, and that applies to college as well, will be asked to continue to test regularly, so twice a week, through until the end of September, at which point, or hopefully before that point, we are expecting a national update which will tell us what the next steps are in relation to testing in education settings. And just to say, it is the same for universities going back as well. So they're being asked to do a mixture of assisted on-site testing and community collect, to do one, say, before they travel to universities. So if they live outside of an area and they're going somewhere else, do another test when they get there, and then to continue with regular testing through again until the end of September. So that's the plan in relation to testing, and that's why we would anticipate when everybody comes back that they'll be doing those tests, that we will pick up a lot of positive cases in the age group, particularly because we know our case rates are higher than our overall case rate in some of these age groups, so particularly in the 17 to 18, and then also looking at the 11 plus age group. So we would anticipate, but it will mean because they will be picked up quite quickly, they won't be in school, and that will hopefully help to reduce a lot of the transmission that might happen at that point of return. So that's the plans in relation to testing, and obviously the main focus, and very clear through the DfE guidance, which I think everybody would welcome, is we want children and young people to be in education and to really sort of minimise going forward their disruption, because we know, as well as the big impact that it has on their education, that it is having a massive impact in terms of mental and physical health and well-being. It is still the case, although there is a lot of what has been a lot of infection, and absolutely, we're talking about the group of people that aren't vaccinated, and whilst it's really good news that 16 and 17-year-olds are now getting vaccinated, they're not fully vaccinated. So we will get case rates. It's not surprising, because they are the people that don't have the protection that others who are fully vaccinated do. But we're still not seeing children, generally in high numbers, becoming ill. There's still a very low risk, sort of clinically, to children becoming ill, and therefore that's why the message is very clear that the benefit of being in school and of having that educational experience significantly outweighs any COVID health risk to children and young people. Absolutely, it is the case, because there's so few children that do get poorly with COVID. There's still a lot we don't know about how it does present in children, and more of that will come to light as we go forward, absolutely. But it is a very mild infection for most. And in terms of sort of protection generally, it will be the case by when teachers go back in September, everybody will have been offered that jab. And by October half term, everybody will have had the opportunity to have their full vaccination schedule. it is still the case that any children in age 12 to 15 who have underlying health conditions or who live with people who are at higher risk from COVID, they are being offered it as well. And we haven't had a final decision, but you will have seen in the news that's been reported that there is consideration being given to extending down to that age group so that all children would be offered that. We don't know what that final decision will be or what the timescale of that will be. I imagine if it is taken that is to happen, that will happen very quickly. But we are awaiting further information on all of that. So in terms of sorry, I thought I'd missed a slide there. It got stuck. I didn't want to move on. In terms of when settings return in September, these are some of the key things that have changed, I suppose, and the important sort of measures that need to continue and that will be happening in schools to help protect everybody as much as possible. So you'll all be familiar with schools operating in bubbles previously. So that would have been class bubbles, and then in secondary schools, pupils would have been in a number of bubbles. So they would have been in their main class bubbles, and then if they took different subjects, they would have been in subject bubbles as well. So there is no requirement, and it's recommended that there aren't bubbles going forward. So that will no longer be happening. And there's no longer a requirement, say, even in the earlier settings that didn't have to operate in bubbles, but they were asked to keep sort of to consistent groups and try to reduce mixing as much as possible. That is not there either. And as it is the case for the rest of the population, there's no requirements around social distancing. There's also no longer any recommendation that there is routine use of face coverings in education settings. There are some circumstances, and this would apply to transport for special schools as well, that face coverings are used on public transport and on dedicated school or college transport. In terms of contact tracing, the policy is really clear that schools will no longer be required to undertake routine contact tracing. There might be some exceptional circumstances where that's asked for, and in most cases, it might be that it will be the local authority that will be asking for that. So if we did happen to have a significant outbreak in a school, we might ask and liaise with the school to do some contact tracing in terms of our outbreak management. And there might be times when NHS Test and Trace go back and ask that as well. But from what we are being directed to, that will be very few circumstances where that will happen. The contact tracing will be undertaken by NHS Test and Trace. So what used to happen previously was if there was a case in a bubble, say in a year 2 bubble in primary school, we know there cases are infectious for 2 days before and up to 10 days after symptom onset. And if we looked at that and they'd been in this setting during that time, that whole bubble would have been isolated as a close contact, because there's absolutely no way you could say that anybody in a year 2 bubble of age 6 and 7 children are not going to have had close contact with a case in that time period in school. So they would have all previously isolated. That won't happen because, as I've said, we don't operate on those bubbles, and it is just the actual contacts. And what will happen is the parent or guardian of the child will be contacted, and they will be asked if they know who the close contacts of their child are, and that'll be in school and outside of school. And if they know who they are, they'll be asked if they've got their contact details. If they don't know who they are and they have not got their contact details, under the policy as it is currently, that will not be followed up. Okay, that is a really significant change. If they do know those details, that will be followed up. And as we've just seen in terms of self-isolation, children under 18 years and 6 months are not required to isolate, so they won't be advised to isolate, but they will be encouraged to take a PCR test. Okay, now if they are over 4 and it's a school-based contact, they'll be asked to take a PCR. If it was somebody under 4 and they're not a household contact, then they won't be. So it's for those 4 and under, you would only be asked as a close contact to take a PCR if it is a household contact. However, they are encouraged to take a PCR, as the adults will be. That can't be enforced, but obviously, as we've highlighted and as the video highlights, it's a really important step to help protect others. So that is what will be happening. What we do need to do is wait and see, being realistic about how this then plays out in September. But this will, very much is the intention to minimise the disruption in schools. Okay, so that's it in terms of, I suppose, what we can expect in some of those key changes. So when children and people go back to school, it should feel much more like it did before COVID in terms of how it's operating. However, the protective measures are still really, really important. So we've mentioned testing, and that's there as one of the key measures. The infection prevention and control measures continue to be really important as well. So regular hand washing and cleaning, good respiratory hygiene. So, getting rid of tissues, sneezing into your elbow, things like that are really important. Putting stuff in the bin after you've blown your nose will be really important as part of this. And then continued regular cleaning and, making sure high touch points are regularly cleaned down with the correct cleaning products, and that is still within all of the risk assessments that schools have in place for September. And it's really important for COVID, but it's really important for all the other winter viruses that we see. So, we are seeing some of the normal winter viruses come back with a vengeance now, and they've come back a lot earlier. All the stuff we'd normally expect to see in schools, and these protective measures will help against that as well. So that is really important. And the schools guidance, does highlight the importance of ventilation. Now we accept, it's much easier to have ventilation and to teach outside and do lots of stuff outside when the weather's nice and you're out and, you can do that and enjoy that space. It's going to be much tougher as we go into winter. The DfE have indicated they are going to be rolling out carbon dioxide monitors. And the idea is that these will be rotated around and they're just used, it's not something that you would have in every classroom. It's in spaces where, there's poor ventilation. But with that, we're waiting for what that actually means and the instructions around it, because you have to monitor it, and it's there to monitor, but then what do you actually do? Because then you have to take action if there's poor ventilation, and that'll be easier for some schools than others. If you're in a very small school, you're going to be sort of limited with the space you've got. So we are waiting for further guidance from DfE around that. Okay, and just to say, we've mentioned the importance of vaccination, and you'll see there, there are pop-up sessions happening, and there's a lot of work going on in relation to trying to reach the 16 and 17-year-olds, a lot of sort of drop-ins and outreach sessions being planned. And I know that nationally and regionally, the school-based immunisation teams are prepping and planning in terms of when we get the call, if it comes, so if the approval is given to vaccinate 12 to 15-year-olds, to get that up and running quite quickly. Also, though, there is also plans to extend the childhood flu immunisation programme anyway right across secondary schools. So there's already a lot of planning happening around that. So that's the position in relation to schools. I just wanted to describe in terms of the contingency framework. So there's operational guidance for all of the different educational settings, but there's also an education contingency framework which was updated and issued at the end of last week. And that's what all schools should be using to manage local outbreaks, or it could be that there's a new variant of concern that emerges that's found in education settings. And they would use this contingency framework to support that. And it very much sets out the role of local authorities, directors of public health and Public Health England health protection teams to set out additional measures. And that's really helpful. So we have more scope than we had before. So a lot of the measures we can recommend without having to always go and get national agreement, because we're working within what's set out in the contingency framework in terms of what we can and can't recommend. And what it also sets is thresholds for when extra measures or escalation may be needed. Now, I am going to go on to describe what these thresholds are, but we can flex it, so they're not set in stone, basically. So, we recognise, and one of the things that our feedback was, it's very different, applying those thresholds to a massive secondary school to a single form intake primary school, but also we need to be very mindful of what's happening with our infection rates locally. And that might change when we might want to step up or step down these thresholds. And the other important thing to just note is we won't be doing that straight away. So for secondary schools, as I've described, we're testing for when they return. It wouldn't make sense to move straight to escalation because we know we will pick up cases because we're doing this regular testing. Okay, and that's something that we're doing in a very targeted way as one of the focus measures to actually identify quickly and make sure people who are infectious aren't in the setting. So in terms of the thresholds I've mentioned, it would be either of these, so whichever is reached first, but like I say, we can flex around this. So we talk about close contacts a lot. The language they've introduced in the updated contingency framework is mixed closely. And what they say is they don't expect that to be, always to be full classes, form classes, tutor groups. However, when you read through the definitions in the annex of the contingency framework, it can be that, but it might just be a friendship group. It might be a group of people who've done sport together. So you would look at and you would do your assessment basically. So what we will be doing in this scenario is working through and doing a risk assessment, and it's very contextual to what the situation is, how the infection is presented, when it's presented, the school, the nature of the school and the setup, how they're running their classes, how much mixing there has been across different groups and year groups, if there's been a sports day, all those things would need to be taken into account. So it's either 5 children, pupils, students or staff who are likely to have mixed closely, or 10% who've mixed closely, testing positive within a 10-day period. So what that would mean is, we might have 5 children and staff all together across a secondary school, but none of them might be linked to each other. There may have been no mixing and there would be independent cases. That wouldn't make us think, right, we need to escalate on the basis of these thresholds because they're not linked. Okay, they could just be independent cases. But if we then start to see from some of those there comes to be more, or we're looking at sort of 10% of a group that we know have some, they either travel to school together or it's teachers and pupils who are in the same lessons together, or an after school club together, then we'll be thinking, well, actually, we need to look at what else we can do around this. And recognising that some schools in some areas are very small, offer particular provisions, such as special schools, that for any that have got less than 20 people in altogether, we'd be looking at 2. So 2 children or pupils or staff within the 10-day period who've mixed closely. So that's what we'll sort of be working to in terms of, I suppose, a bit of a red flag going up, and wanting to look at and understand a little bit more about what's actually happening in that setting, and then look at what other measures we might want to put in place. So the extra measures would be seek public health advice. Now, in the contingency framework and nationally, the DFE helpline will continue, and that will continue to be available. But it has been made clear in the guidance that it would either be through the DFE helpline or through other local arrangements. We've reached an agreement across the northeast areas that we are all going to ask schools to report into the local authority. And the reason for that is it means we get the information much quicker. Because although we get some data down from DFE, that's only based on what information people put in, so parents put in. So if they don't identify which school it is, then we would never know. And the same for staff. If they don't identify where they work, we wouldn't necessarily know about that in terms of the actual individual setting. But we also know it can be quite frustrating for schools to have to go through the DFE helpline, if I'm being honest. It gets very busy. There can be quite a wait for it. And you know, I think everybody just generally has a lot of confidence in the advice that we're all able to give locally. And we've built up those good relationships over the pandemic with schools. So we've worked very closely within public health with the schools. So, you know, they're used to coming through to us. So we're going to do that. And we're looking at trying to set up some online forms and systems to make that a bit easier as well. And we'll not need as much information because they're not doing the contact tracing, but we do need to know about the actual cases. What they would then do if they had an increase in cases, they would revisit and reinforce. So, you know, remind people about the importance of regular testing, both staff and children of secondary school age and older. Make sure there hasn't been a lapse, for example, in the hygiene measures. Look at what else they could do to maybe improve that if there's a particular area that might be causing concern, and look at ventilation measures, and, you know, just make sure that, you know, it isn't things like in areas run out of hand wash or hand sanitizer, or, you know, sometimes you can get something, you know, there's a problem with the water, or the kids have just got out the habit of washing their hands regularly. So you would revisit all of that. The other things that we could do, and we could use one or all of these, is we could actually say, look, we want to do more regular testing, so we could increase the frequency. So, you know, we could say actually we want to test 3 days a week, just for a period of time. Or we could also ask secondary schools, for example, to say, look, we know some people are doing home testing, but we're not confident everybody is, because, you know, let's be honest, not everybody will do it, but also lots of people do it, and if it's negative, they're not logging the results always, and that's an issue across the whole of the population. So we may actually, we want to reintroduce the ATSs for a 2-week period and get everybody tested. That won't be without logistical issues, because it does have quite an impact on schools, but we wouldn't be doing that across every school all at once, and so we may be able to look at some support for schools around that, and we would work with them. And all of these measures, I must say, you know, we can't impose on schools. This would be a discussion with schools, what we think might be helpful, what they think might be helpful, what could be done, and they have to agree to this. So it's very much a sort of collaboration with them in terms of the measures we were put in. We also can reintroduce face coverings for up to 2 weeks, and that could be either in communal areas or in classrooms or both. And just to let you know, we are actually going to write out the schools. I know a lot of them are already planning to continue with it, but given the rate of infection we've got, and, you know, the high rate that we still got in some of our younger age groups, we are actually going to recommend that in primary schools staff continue to wear face coverings in communal areas, and that secondary schools reintroduce in communal areas just as we go back in September. We can also say, look, we want things like educational visits or transition days, or if you started letting parents come back in for certain things, we want that to stop for a period of time whilst we just see what plays out with the outbreak. And as a very last resort, you know, and it isn't something anybody would do lightly, and, you know, it's not where we want to get to, and I can't really envisage it happening, is attendance restrictions, where we go back to what the position was in lockdown, where the majority of children are asked to do remote learning, and it's vulnerable children who are in school. So, you know, that is there. It's certainly part of the contingency measures, but it's not being envisaged that would be used. And then shielding can be introduced, but that isn't something that can be introduced locally. That would just be as part of national government direction, as part of their decisions. So in terms of how you can help, you know, as always, there'll be lots of social media posts, so keep an eye on that, and, you know, do share the posts. We really appreciate that. And as Louise has mentioned, information will be added as well in the newsletter next week. There is information on that link for back to school, so information for parents and carers there. Continue, because vaccination is so important, continue to encourage all those eligible to get vaccinated. And again, there's a link there that people can go to for more information. Absolutely, you know, the requirement to isolate and get a test if you have symptoms, and then to isolate for 10 full days if you have a positive PCR test. is still there. That has not gone away, and people must do that. And there's information there on testing as well. And then that link is the link to the self-isolation guide video that we just had a look at before, to help people understand the rules around self-isolation of close contacts and when they have to isolate and when they don't. So again, use that and please do promote it. And I've just put a link to some of the guidance documents in relation to schools, but also the updated close contact guidance for households and people outside of households. So that's there if anybody did want any more information. So I'm going to stop sharing that, and then that leaves us 5 minutes for questions before the next presenter joins. Always
just quite self-explanatory. It was really good.
Yeah, well, I think that's what it is. I mean, yeah. You know, and we're not going to pretend there's not going to be an increase in cases. There absolutely is, and we have to expect that. And that's why actually it's really important that everybody continues to be vigilant and thinking about themselves and others. And it is challenging because, you know, every time I have to go somewhere, there's less and less people wearing masks out and about and things like that. But it is really important because it has not gone away.
Yeah. I find myself in the supermarket actually stepping away from people because they're just not keeping that 2 metre distance anymore. Just going to be cautious.
Okay. Well, that might mean you'll have time to do those questions that you wanted to do quickly then, Jane.
Yeah. So what we're going to do, if everyone wants to take part, it's just a quick online survey. I don't know if anyone's used Menti before. What I'll do in the chat, I'll just put down the address. So it's just www.menti.com. It's completely anonymous. What I'll do, I'll share. It's just going to be 2 questions that we're going to ask the audience, and if you can just give us the answers, it'll just help with future meetings and future planning. I'll just find my screen. Oh, Nicola's just appeared in the lobby, but never mind. Right. So if everyone logs in, and then if you put in the code 7142 990, it's also on the slide. Lorraine, can you see the slide on my screen? Is it presenting?
Yes, I can see the slide.
So if everyone's logged in, if you just want to make a comment, and it'll just show up on this screen. So the question was, have you noticed any issues since lockdown ended on the 19th of July? Just anything you've noticed in your community, you know, anything dangerous, anything that you might have noticed. I don't know if anyone, has everyone managed to get in okay? I can't see anyone's faces, so I'm just sort of looking at me presentation. Oh, there's a comment there. Like I said, it's completely anonymous, and we're just going to keep this, you know, to plan future meetings. Yeah, so someone's mentioned there's confusion in rules relating to social distancing. Diverse communities needed some support and multilingual information. I mean, we are happy to try and sort that out if you just email direct. Someone's mentioned that people have stopped using masks on public transport, especially the metro. Yeah, I've noticed that as well. Someone's also put, personally, my parents are still very nervous about getting out and about. I think that's the case where some people are. You know, they've been shielding for so long, and I suppose I think once everything's relaxed, you know, it's more dangerous out there. No one's distancing, no one's wearing masks. So it is quite nerve-wracking for a lot of people. People have got anxiety related to socialising. Yeah. Yeah, I think that's it. So I'll just move on to the next question. If you did want to add anything, you can just go in your own time. So next question is just, what barriers or reasons have you heard that are preventing people from getting the vaccinations? So there's any sort of excuses or any crazy theories that you might have heard? I think in the beginning there was a theory that the people are getting chips implanted in the skin. I'll just give it a couple of minutes and then see if anyone's got anything. Yeah, so someone's mentioned blood clot figures. Yeah, and there's still people who think it's a conspiracy, unfortunately. Or if you've already had it, you won't get it again, which isn't the case. Yeah, another conspiracy theory, dubious about the effectiveness and after effects. Yeah, it's quite a lot of conspiracies coming up. People scared of falling ill or having to take time off work. As I mentioned, we do have a vaccination meeting on the 9th of September, so we will be sort of addressing things like this. But yeah, that's great. I think that's probably all the comments we're going to get, so I'll just close that down. Let's see if I can stop presenting. Well, thank you, everyone. That was very informative. It was just nice to get other people's opinions rather than us dictating to yourselves. It's nice to get, you know, what you're seeing in the community as well. I think Nicola's joined us, and there wasn't any question. Hi, Nicola. There wasn't any questions on the back of that Menti survey, was there? From anyone? No. Nicola, are you okay to chat now? Thank you for coming in.
Oh, hi everyone. So if you haven't been on any WIN training, Wearside Women training, then I'm Nicola and I am the hospital independent domestic violence advisor. I do quite a lot of community engagement and the accredited training that we run as well, which is free, and anyone who's working, living, volunteering in Sunderland can go on. So check out our websites. We've got level 1, level 2 domestic abuse accredited training, and we've got level 3, which is at a specialist level. I don't think that's on the website just yet, but yeah, if you want any kind of like training or development, we're also doing a bit of early prevention work. So we're training community ambassadors to kind of bust all the myths around domestic abuse and going into communities and putting leaflets up and having like kind of conversations with people about, you know, support services. So that's the Ask Me Ambassador. So that's a different kind of training that we're not been doing before. So it's that early intervention prevention work, which has been going really well. So so yeah, I've been doing lots of community engagement stuff around that. With everything opening up again, it's been really good to like actually get out in the community as well and work with the police and do some community engagement with those as well. So yeah, so I'm at the hospital 3 days a week. I'm in one of the rooms. I might get kicked out, but I've asked for it for 15 minutes, so hopefully shouldn't get kicked out. So what we're going to just like talk through for like 10-15 minutes is around what's been happening with COVID and you know, the lockdown and how that's affected domestic abuse and domestic violence as well. So I work in the hospital and I see the kind of like direct impact. It's the traumatic kind of side of domestic abuse and violence as well. So I'll see people who've been brought in by the police. I'll see people who have been brought in by ambulance, or they might disclose on the ward, or they might be brought in because of something like malnutrition or something, so they need building up, that kind of thing. So see all sides of the hospital as well. So I've got people as young as 16 and right up to 90. I've got people who are homeless, to solicitors, doctors, nurses. I've got an ex-tennis pro as well. Is on my books at the minute as well. So the people who we see in the hospital is a greater variety as well. All different genders, all different sexuality. There isn't any one type of person that I see. There's no one age group that I see. I see them from all across the spectrum as well. So I do see a lot of different types of people who come in to see us. So, COVID, I've worked through COVID. There was only a tiny little bit, I think there was 3 months in the first lockdown where the hospital said, if you're not medical, you're not coming in. So I went and worked from one of the refuges, but I was like meeting staff at the gate and like bringing in pajamas and telephones and doing safety planning with people, kind of, but not in the actual wards, but we're back in the wards and everything. From, like I say, from about 3 months after the first lockdown, we were allowed back in. So hospital, health settings and GP surgeries have been like amazing through lockdown, because that's where we've still been open. We've got a GP advocate who's in about 22 surgeries across the city. There's me as well. So with us being part of the NHS, I can access doctor's surgery. So if they're not even part of our projects, I can still get in and see people. We can make appointments for people as well that aren't real appointments. So we'll just, one of the consultants the other week just put in a bogus appointment saying we need to renew your medication. So I was actually sitting in the room well before the woman came in, because the perpetrator's with her. So I was in the room with the doctor when she came in, so he hadn't a clue that I was there and helping. So it really has been a godsend that perpetrators aren't allowed in the healthcare settings, and women can still, because normally women who I see in them kind of settings, but can be anyone. So yeah, so this kind of service has been amazing. So we did it before COVID, but it was like the only way we could get to see people in some circumstances as well, because people weren't being allowed out. So there's been loads of stories in the news about domestic abuse and that it's increasing. So what we have seen is a 20 to 25% increase globally. We're talking about Brazil, France, Italy, Spain, Australia, all the major countries. UK, we're looking around about 20% as well. What we did see was in the Chinese province, and of the initial corona outbreak, they said domestic abuse tripled during their lockdown. So we've seen a lot of increases. In Sunderland, the domestic abuse figures went up around 14–15%, but what we actually saw a lot of, which people probably won't even think about, is stuff like sexual assault and rape. And in Sunderland, for the first 3 months of lockdown, rape figures increased by 156%. So that's within domestic abuse cases. When we're looking at deaths, we've seen an average of 5 deaths in every 3 weeks, where normally we're seeing 3 to 4 deaths in them weeks. So we've seen a lot of deaths as well of women. There's been horrendous stuff Sarah Everhard and sort of, so violence against women and girls has really increased. We've seen online fraud, online sexual abuse, rape and domestic abuse all going up. But overall, crime has dropped since lockdown was announced on the 23rd of March. But domestic abuse, child sex abuse, rape, online fraud have all gone up. So yeah, so at least 16 suspected killing of women, 14 women and 2 girls were reported in March till April, and that is like tripled the normal kind of deaths that we're normally looking at. So if we look at like other figures from other places, the National Domestic Abuse Helpline reported 120% increase. Respect the phone line for people concerned about their own behaviour, so people who are abusing and want to stop, so they're increased by 25%. Nirvana, Carmen Nirvana, an honour-based forced marriage organisation, said their calls that came in 33% were due to lockdown and fears around honour-based abuse in lockdown. And Crime Stoppers said they received an increase of 49% in reports of domestic abuse as well. So we're seeing it across the board. So perpetrators were really using the current situation to further their abuse. So it might be selling food parcels to buy alcohol, insisting only one person leave the house, really putting that control in place, not allowing the partner to leave the house to go to the shop or exercise, saying it's not safe. One woman wouldn't even go out with her dog. She'd open the back door, let her dog out, and then get the dog back in as soon as it went to the toilet, because she was worried that it was airborne and she was going to get it, because that's one of the things that the perpetrator was saying. Using the virus to pressurise people into leaving their jobs, to isolate them further, using fears of catching the virus, insisting their partner is responsible for the childcare, not letting the children go to school. So that kind of like enforcing the whole family to stay within that control. Refusing to adhere to social distances as well. So women were in fear that they were kind of looking after themselves, but the partner wasn't. Using children as well to justify not returning children after contacts. So lying about having symptoms or needing to isolate the children as well. We saw lots and lots of control around children and not handing children back, sometimes keeping the children for weeks and weeks, saying that they couldn't move them because they had symptoms, couldn't take them out of the house, that kind of thing. What we've seen in the hospital as well has been a lot of family stuff, so familial stuff, a lot of mother and son, dads and sons, grandmothers and grandsons, lots of neglect going on there. Like I say, lots of people with malnutrition being left on the floor for days and days because they won't pick them up. And like say, one of my women was in the kitchen and the husband and the son just kept walking over her. They didn't say how she was or like help her up or anything like that, and she ended up in a hospital due to neglect as well. So lots of stuff around families, lots of stuff around neglect. There's a woman called Jane Monkton Smith, and she did the homicide timeline, and there was quite a lot of stuff going on around April time. There's been quite, like say, a lot of murders that have been happened. Escalation in violence has been massive as well. So her kind of timeline is like looking at is there a pre-relationship history of violence? Is there been an early relationship? So what we've seen is a lot of people were thinking after the first 3 months lockdown, we're going to move in with these partners because we don't want to be away from them too long, or the partners have no control over what's going on. So they've been like making women come and live with them as well earlier than they would. So it's this early kind of relationship, early declarations of love. And Jane Monkton Smith describes it as like twice the speed of a normal relationship. And then what she classes is coercive control. So that control, you can't go out because of COVID, or you can't go to the shops, or you can only go to the shops for half an hour. So one of my women could only go to the shops on a Sunday at 3:30 when the shops were shutting at 4 o'clock. So really just letting people getting out for like a tiny little bit of time. So that kind of control, and then trigger. So step 4 of the 8 steps is a trigger. And what Jane Monkton Smith says is that before lockdown, most controlling people were at stage 3. So they've had this history. There is an early relationship. There is control and coercive control and threats going on there. But now every person who's abusing is at this trigger stage. So they've lost the control of what they can do. They might have lost control of the finances. They might have the kids with them to like 24 hours a day. They might have, you know, lots of things going on with their mental health, but she says that they might not move on to homicide, but every single abuser is now at that level 4. So we've really got to be careful when we look at like triggers and COVID as well. So when we're working with people, we really need to kind of like know what services are around and what's happening. So I'll send out some details of local services, but for domestic abuse, it's going to be Wearside Women. So I'll send you our details around that. It's all right. So yeah. So what indicators to look out for is just changes in behaviour or the way people are acting, if it's out of character for them. Are they wary of talking to you? Are they anxious of talking to you? Is there a reluctance to talk in the home about the home situation, or do they avoid answering questions about what's going on at home? If they've got long silences or delays in responding, you know, are they thinking about, you know, what are they going to say? Is the perpetrator listening? Is there a family member around who, you know, could maybe take that information back to the perpetrator as well? Because what we're seeing is multiple perpetrators as well throughout the like kind of family situation. So when we're responding to domestic abuse, what we do is we ask if there's a safe time to talk. Always presume that the perpetrator's there unless you know 100% they're not, like if they're with you face to face. If you're using the telephone, just say, are you all right to talk? Is it safe? Are you alone? Is this private? Before you start kind of asking any questions. Find out if there's a good time to call. Like dog walking has been ideal because the perpetrators is usually taking control of everything. And if there's like an animal in the house, like a dog, then they've taken control of going out and doing the dog walks and stuff like that. Code words have been really important as well. So one of my women uses hula hoops, and she'll just say, oh, the kids have asked for some hula hoops in the food bank, that kind of thing, and that means that she's in danger and she needs the police. Another woman just texted me and a friend P, the letter P, and we know that means police. So having a code or a phrase that you know it's safe for them to use, and you can respond quickly with them. Safety planning is 999, and if it's anything urgent, it's always the police. So 999 if there's any emergencies. Wearside Women aren't an emergency service. Our independent domestic violence services 9 to 5, Monday to Friday. Our refuges are 24 hours, but the actual advice service is 9 to 5, Monday to Friday. So always use the police. 999 if there's an emergency. If they can't speak, they just wait till they can hear the operator and then press 55. It's called silent solutions, and then the police will try and track the phone and see where they are. Lots of apps out there at the minute as well. So there's Hollyguard, Bright Sky, and what happens is with Hollyguard, if you just shake your phone, inside the app, it's like got like your emergency contact number, and it'll tell them where you are as well. And Bright Sky is all around support services. So wherever you are, you can open that up. It looks like a weather map, but actually there's some like support services in the area where you are. Who else can people contact in emergencies? Really good. Refuge spaces have been very few and far between, so we've been having to get people to like Scarborough, Redcar, Gateshead, Sheffield in one time, down in Sussex another time, up to Glasgow. So people might not want to go that far, or you know, they might not be able to go right there and then. So who else can people contact in an emergency to go and find a safe place until we can get things sorted out for them as well? Always think if you need to contact other agencies. I'll send out details of MARAC, so multi-agency risk assessment conference. So you do a checklist if someone discloses abuse, and then if it's 14 ticks or there's something really red flagged in there, then you can do a professional judgment to MARAC and get all the agencies around to support that person. Okay, and it's just really letting people know where you are, where the services are, what services are open, because we want to give that right response, and I'll put that in some slides to send to you. But Wearside Women's the main place in Sunderland, and our 24-hour helpline is 0800 066 5555. Okay, any questions or anything you want to ask?
Quiet audience. Oh, it was brilliant, Nicola. It was quite hard hitting, really. You sort of don't really know like the figures or what's going on behind closed doors unless you work in that service. It was.
Yeah, we do a 2-hour course where we go into a bit more detail on COVID and the impacts of COVID and domestic abuse, and we talk about the new domestic abuse bill as well. So if the COVID champions want that, we can always organise something like that.
Right. I know we've overrun by 5 minutes, so I think I've lost a few people. Oh no, it's not your fault. Because I know you'd only made it a 1:45, and then I was doing that Menti survey. But yeah, that's brilliant. If you can just share the information with me, what I'll do, I'll send it out to the COVID champions with the meeting recording. Send you information on the apps. I'll resend the phone number as well, just in case people didn't jot it down. I'll also send around Lorraine's slides on schools and the COVID update. But yeah, thank you for joining us today, Nicola. It was really informative. But just one more call for questions. Has anyone got anything? I think everything was self-explanatory, though. It's, like I said, very, very hard-hitting, isn't it, when you hear about it? Yeah, that's brilliant. Well, I hope everyone enjoys the rest of the day. The next meeting is going to be September the 9th. That's a Thursday, and it's 12 till 1 on vaccinations and long COVID. But yeah, that's brilliant. Thank you for joining us today, and have a great bank holiday weekend. Thank you. Bye.